So can you talk a little bit about the timing of the person, when that person died? I mean, if you're not able to say the exact date, or give us a range, was it in the last week, was it in the last month? And is there anything preventing you from saying exactly when they died?
Again, I don't have the medical record or any of those identifying information. I can say safely that this report of first death in Wisconsin was within the last 24 hours.
That individual man or a woman?
That is not necessary for us to share. All men and women are susceptible to a novel strain of H1N1.
Can you say, was this person in one of the high-risk groups?
They had a common underlying medical condition which increased their risk to complications from influenza.
High-risk age groups, you mentioned people over 65. Would this person be in that high-risk age group?
Again, we mentioned several high-risk groups here today. This individual had a common underlying medical condition that increased their susceptibility to complications. It would not change the prevention advice that we're giving to the public.
So what does this mean now that we have the first death? I mean, people might have started to feel kind of complacent, that it was going away. So what does this mean? Does it mean that you sound the alarm level, raise it a bit now, or what does it mean to the average citizen?
I think to the average individual, we know that disease is circulating in our community, and we know that there are certain individuals who are more at risk than others. We carefully outlined earlier that those groups that are considered to be particularly at risk need to take extra precaution. Our healthcare providers need to be forever vigilant as they have individuals who present within their medical institutions to provide the emergent and necessary follow-up. This disease is here, it's in all 50 states, and it is circulating. We're doing our best to surveillance and provide appropriate prevention measures. This is not the time to back away from that, but it's not a time to raise the alarm either.
Is there any indication that Wisconsin has an elevated rate of H1N1? There have been some suggestions that there might be more people in Wisconsin having this.
Well, the CDC website shows a higher number of confirmed and probable cases for Wisconsin than most other states. Still, all the evidence that we have indicates that this reflects a very robust testing capability. In Wisconsin, we have two very excellent public health laboratories and two private partners who have a high throughput capability that other states do not enjoy. We have been able to compare other types of information, like unusual numbers of people coming to hospital, people coming to hospital with flu-like symptoms, people coming to general practitioners with flu-like symptoms, and Wisconsin does not appear to be atypical in any of those regards.
How many cases are confirmed statewide now? You mentioned numbers reported by the city.
We've, as of this morning, 2,074 confirmed and probable cases in the state.
Dr. Cole, the city's position on not releasing the gender, the age, or any identifying information, we have seen other areas of the state release more information about the patient. Is the city's position, is that in line with the states, or are they taking it too far?
I totally respect the need for public health agencies to respect the privacy of individuals who are affected, except when the public interest would be served by divulging more information. So I feel very comfortable with the city's position.
Is the city's position more strict than the state's position?
No, it's not.
So the other counties are not following what the state would have?
We don't have to regulate what they say, but our practice is similar to the city's. Thank you very much.
Thank you.